going. So kia ora, Gingeri, and welcome to today's webinar, Social Impact and Social Housing, Measuring What Matters. For those of you who do not know me, my name is Mark Henderson and I'm the CEO of the Australasian Housing Institute. We're also well known as just AHI, and our job at AHI is quite a simple one. We're here to support the professional development needs of anyone with an interest in social and affordable housing. I'd like to acknowledge the traditional custodians of the land on which we collectively live and where we join this webinar today from across Australia, New Zealand and the globe. I and AHI recognise and support Indigenous people's continuing connection to land, water and community. I pay my respects to all Indigenous elders, those who are past, those who are present and those who are emerging. Firstly, I'd like to thank the team at CHL for their collaboration today. The topic of social impact has clearly resonated with all of you. And today's webinar has seen the highest webinar registrations from any of the work that we've done before. We've got 463 people registered for today's event. This subject has not just caught the attention across Australia and New Zealand, where a lot of us work. We also have a number of people in attendance from right across the world, including a couple of our partners in London at an eye-watering 3:30 a.m. A special shout out to you. This is clearly a topic of great interest, not just here in our region, but across the planet, and it's a joy to be able to be part of this conversation. And isn't it great that CHL is leading the charge and sharing their insight with us today? Before I introduce our panel, I just wanted to work through a couple of items of housekeeping. Firstly, the webinar is set to run for 1.5 hours, and through this time I encourage you to interact with our panelists, ask questions, make comments. The greater this interaction, the greater the learning opportunity for all of us. We are using the webinar platform from Zoom, which is slightly different to the traditional Zoom meeting platform you may be used to. Namely, rather than chat, we'll be using the Q&A feature. You'll see this on the bottom of the Zoom taskbar, and this is where you can post questions and comments to the panel. You can also upvote on the Q&A tool, so you can highlight what questions you'd like to have responses to. We're also going to utilise the polls feature, and let me just launch the first poll question with you now. Okay, 1 second, here we go. Okay, if you could have a look at that poll question for me. And just give it 30 seconds and then we'll share the results. And this is an important part of our conversation today. Okay, let me just end that poll for you and share the results. And I think our panelists will talk to this just shortly, and clearly we're all feeling quite secure in our current location. All right, again, thank you. Lastly, the webinar is being recorded and it will be made available on our AHI portal and across a number of our public video platforms. We'll alert you once these are live. Now let me welcome our panel with us today, and you can see them on the screen. Professor Paul Flatteau is the Chair of Social Investment and Impact and Director of the Centre for Social Impact at the University of Western Australia, and a recognised expert in housing and homelessness research and policy development. Paul, welcome.
Thanks, Mark, and thanks everyone for coming. It's a great audience, 201 I can see right down there on the live screen, so good to be here.
Excellent, thank you for being with us. Kevin Robbie is a director at Think Impact, leading social impact consultancy in Australia. Prior to this, he was the CEO of United Way Australia, and before that, Executive Director at Social Ventures Australia. Kevin, welcome.
Thank you. Cheers.
Dr. Lucy Bergman was on our agenda today, but unfortunately, Lucy has fallen ill and is able to join us. And Lucy, we wish you a speedy recovery. In her shoes is Brett Wake, and Brett is the National Manager Operations for CHL, overseeing all CHL Australian housing and homelessness services, and has been in that role since 2016. Prior to that, he was the Victorian Tasmanian State Manager, and Brett has worked in housing, health and disability services over the past 30 years, both in Victoria and New South Wales. A late starter, but welcome to you, Brett.
Thanks very much, Mark. Really happy to be here.
Brilliant. So now we're going to get into the webinar. And again, I'll just remind you, please use that Q&A feature on the webinar platform. Again, this is where we're going to get some good stuff and questions to our panelists throughout the 1.5 hours that we're with you today. So to kick off proceedings, each of the panel are going to have a short presentation, around 10 minutes. And we're going to start with Paul. Paul, over to you.
Great, and hopefully you can see my screen. If not, I can talk to you anyway, but you should be seeing my screen now. And I'm just going to talk about why we want to measure and demonstrate the impacts that housing has on people's lives and how. And I'm going to do that in 10 minutes, which is quite an ask, but I think we can do it. And I do use the word demonstrate because we have to use robust methods of measurement to be able to demonstrate, as opposed to simply saying that we've got that impact. So the word demonstrate is very important. So just in terms of the why, I want to go back to work that we've done with the Bank West Foundation, sadly no longer with us, but it was in the Social Impact series, and it was on outcomes measurement in the Australian community sector. We did that over a number of years, and this was the last issue in that series. And that showed a number of things. First of all, that there was a huge appetite for measuring outcomes in the community sector and amongst housing organisations and homelessness organisations. And why do we want to measure those outcomes? Lots of different reasons. I've highlighted improving people's lives as the ultimate reason for that. But, you know, value for money. Are we spending our money well? Are we getting outcomes per dollar spent? Improving effectiveness, strategy and planning, informing and motivating staff who can then see that their work is creating those outcomes more generally beyond what they're seeing directly with the people that they work with. And adjusting service design and housing to better meet the needs of consumers. But ultimately, we're measuring outcomes to improve people's lives. Here's a very simple program logic around that. Now, if I produce this for exam, I'd say, well, you know, you need to put in a few more lines here. But what does good social impact measurement do? First of all, it improves knowledge and awareness of the social impact of housing. So knowledge and awareness, and that knowledge, once it's properly demonstrated, should, in my view, provide increased funding because housing works, because community housing, social housing, and other forms of housing that meet people's needs, particularly in the vulnerable sector, and particularly around affordable housing works. Now, you might have all the measurement of the world, but we do know that you need to combine that with political will. So measurement is not everything, but it matters a lot, but political will also matters. And here I'll reference the recent Commonwealth budget, which had a lot of amazing things, but probably missed out a little bit in the housing area. What does that do? It increases the supply of affordable housing, more support services, and that leads to improvement in people's lives. So what I want to do now is just give you a couple of illustrations of the work that we've done, where we've demonstrated that access to affordable housing amongst those that are most vulnerable in the community matters. And I'll at the same time talk about how one might go around measurement. So here, this is a project that was done in Western Australia, and it involved data linkage between public housing on the one hand and hospital data on the other. And we combined, if you can see that, the data from the housing, and WA Housing has incredibly good public housing data, with the health data. And we were able to distinguish those who entered WA public housing from a national partnership agreement on homelessness, and this is going back a few years for those who are aware, program. And that was all about those who were experiencing homelessness, entering public housing, so being supported to move into public housing. So what did this piece of work do? What it did was to show that once you had that movement from homelessness to housing, and in this case it was public housing, but the same results apply for community housing, we see a tremendous impact in terms of reduction in healthcare utilization that is, if you like, almost unnecessary because of the nature of homelessness being experienced. So some healthcare, of course, increases, but what housing does is provide that stability, real stability with support that reduces healthcare utilization and then reduces costs. So we had a 16 million return on a program that certainly came nowhere near that in terms of program costs, with the greatest return to that area that had the highest cost prior to entry, and also was a program that had high costs. So programs that have high support, high costs often end up with good returns, as it turns out. So that was one study. Another study I'll talk about, and I'll finish with this one in terms of measurement and impact, is a story around Journey to Social Inclusion program in Melbourne. And again, it was around chronic homelessness. So what we were looking at was, does the program intervention work to improve people's lives? And the starting point for that is, did the program enable people to access housing? And what we found was the program had a significant differential impact relative to what we call a counterfactual. In this case, it was a randomized controlled trial. So the differential impact of the program is seen as that gap between what you get with the program, which got up to 91% of participants accessing public housing, community housing, and private rental housing, over a long period of time, I might add, compared with those who didn't get access to that particular program, but were getting access to some very, very good Victorian programs. So that is looking at the question of how one measures by ensuring that you've got a differential, in other words, the counterfactual, what would have happened otherwise, and what did your program do? And that's a very important how kind of question. What else happened in terms of the group that got into housing in the main? In other words, the group who got the Journey to Social Inclusion program support. Well, what we saw was over time, and here's another point about the impact of housing, but also how you do social impact measurement. We saw a reduction in depression numbers, anxiety numbers, stress numbers, because people were in a much more settled position. We also had reductions in substance use and risk against the baseline. And they were significant. And in some cases, of course, people are still continuing. And so what we're more concerned about is the risk factor. There was significant cost savings as well. Total estimated savings, 98,628, as it turned out. And so you got these returns. And overall, what we saw in terms of savings to the Victorian government. So these kinds of programs, and I'll just stop sharing now, these kinds of programs are working. Housing is doing a good job and is providing support. It is providing stability, both in terms of health and in other areas. When you measure well, you can demonstrate that impact. So measurement matters because it demonstrates impact, and the program went on to receive further funding, in fact, via a social impact investment.
Thank you, Paul. Paul, can I just ask, we've got just a question come through from the audience. We've got two now. First of all, the J2SI group in the study, are you aware who they are? Can you talk to that?
Yeah, the J2SI group in the study were those who experienced chronic homelessness. So both the participants and the control group were those who were experiencing chronic homelessness in inner city Melbourne. So they were randomized as it was a randomized controlled trial. So all of those in the study have been experiencing chronic homelessness. And so it shows that with the right kind of program, you can get people accessing housing, and it was a housing first kind of program. So it was rapid transition into housing with support over time.
Yeah, brilliant. Thank you. And just another one for you, Paul, is how did you track and collect data to understand the decrease in mental ill health, depression, and substance abuse?
Yeah, so there was two methods of data. Well, in fact, three. There's also a qualitative report I would refer you to from the Sacred Heart Mission website. So go to the Sacred Heart Mission website and you'll get all of that. But essentially, we did three things. One, we had qualitative interviews. Two, we had a 6-monthly survey that tracked people over a 4-year time period. And that was both those who were receiving support and those who weren't. And that's how we got the mental health, depression and substance abuse numbers through the survey. And then when we're looking at the health and justice system numbers, we actually used two systems. One was linked administrative data, and so that covered the entire sample, linked administrative data, with consent. And we actually then used those numbers as opposed to just the self-report. And yes, this was actual realized, it's not notional. So the savings were directly realized in the health system. And when I say savings, it is reduction in healthcare utilization, resulting in reduction in healthcare costs for the group in question. Now, did the Department of Health, if you like, it's a bit broader in Victoria, did the Department of Health identify that money and say, right, we've got a budget savings? No. What that effectively meant was they had more people to go on to other service delivery, and that equated to those dollars.
And Paul's asked a question, I think you've just answered it, Paul Reardon asked about it being realised or notional. Paul, what we might, sorry, did you want to go?
Yeah, I was just going to say in the chat, Darren, it was 189 sample, and it was randomized. And as I said, we had qualitative interviews at various time points yearly. And then we had a survey, and then we had linked administrative data, and all through consent. Every bit of this was consent. And if someone wanted to stop, they could. If someone wanted their data destroyed, they could do that.
Yeah, excellent. And that qualitative report, Paul, we might chase that link up with you, and we'll get it out as part of our post webinar.
Yeah, you can follow through
notification.
Yeah.
All right, brilliant. Paul, I'm sure there's going to be a number of other questions for you, but let's shift gears across to you, Kevin. So, Kevin, when you're ready, we'll get your presentation up, and there we go. Brilliant. Over to you, Kevin. Thank you.
Thank you. Great to be with you all. And thanks for that, Paul, as an introduction. I've been asked to do a sort of high-level overview of the how, the why, and what impact measurement really means for social housing organisations. For those of you that don't know me or my organisation, my name is Kevin Robbie. I work for a company called Think Impact, and we work with organisations across all sectors, whether it be business, government, philanthropy, the for-purpose sector, to help them manage for better impact. And we've got a bit of a specialism in terms of working with housing organisations. So why manage for better impact? Paul alluded to this earlier, and I think for me there's really 3 reasons that for-purpose organisations should be thinking about this. The first one is to understand how well you're achieving your purpose. You know, you're a for-purpose organisation, really you should be focusing on this as an organisation in terms of the decisions you're making. The second one is we're all in the game where we get money from funders in different ways, and it's how do you communicate to your funders that you're delivering value. But the most important one is how can you improve your services to actually achieve more impact? If you don't know what impact you're having, then you're not actually able to improve your services. And so for me, they're the 3 main things that we see driving organisations to begin to manage for better impact. And part of the big shift that's happening within the sector, and this is not just in the social housing sector, but I think across other sectors at the moment, is moving beyond reporting on outputs. You know, not that reporting on outputs isn't important, but actually it doesn't for us go far enough. And I'll use this example. 7 people turn up for welfare advice with a disability. So what? Right, they're there. Did they get good advice? Did they get bad advice? Did anything actually change for them? If all you actually do is report the number, you don't actually know what's changed. So the question is, what changes as a result of this welfare advice? And you have to go beyond the output to actually think about what the change is. And so while we see outputs as important, they're necessary, but they're not sufficient in terms of understanding change. So what do you really need to do to begin to understand the change that you're wanting to make? And so for us, it's about making use of data. We all collect loads and loads of different data. And what we are seeing as we're going into organizations is lots of user data, quite good engagement data. Lots of people have really good output data. The feedback data on what people think about services is less concrete, and really in particular, the outcomes data is lacking for a lot of organisations at the moment. And if you're going to be in the space of measuring your impact and beginning to manage for better impact, you need to be starting to collect that outcomes data. And that means putting in place processes to be able to do that. And what are the foundations you need to be able to have in place to be able to do this? The first one might sound as if we're stating the obvious here, but you need to be clear on your purpose. And you know, I joke about this a lot, but I took over a number of years ago as a chief exec of an organisation back in Scotland, and I described my initial period in that organisation as unpicking the purpose of that organisation, because my predecessor had, the mission statement was like a scroll. She had literally added a bullet point to it every year in terms of the money that she was chasing. And sometimes if we're funding led, our purpose can get a bit blurred. And so for us, we see going into organisations and working with them to get clear on what your purpose is, because that clarity of purpose actually drives the thinking about impact. Then there's a few tools you need in place. The most common ones are a theory of change tool to help you understand what you think you're going to change and how you're going to do that. And the process of doing that theory of change helps you to develop a product, to communicate with your stakeholders, but also to develop a plan to bring about that change. You then need an outcomes framework, which is another technical term, but a tool which helps you think about what you're going to measure, who's responsible for that measure, what tools you're going to use in terms of surveys, etc. And Paul's alluded to some of the methods that are out there to be able to do that. And then finally, you need a report to actually communicate that impact. And that can be as simple as a part of your annual report where you're talking about impact, a separate impact report, all the way through to more complicated, you know, evaluations or social return on investment analysis, that type of thing. But in terms of, when I think about the housing space, one of the bits that for me, I think in terms of measuring impact, where the most exciting bit sits is in the what you then do with this. Because for me, community housing organisations or social housing organisations sit as anchors within the communities they operate in. And so as part of that anchor space, really you've got this ability to begin to use data, to use the knowledge that you're getting from your impact measurement, to begin to design differently. And that means working with funders, other partners, with the communities and with policymakers to begin to co-design new solutions, so that you're doing more than housing. You're actually looking at what can we do to actually change the lives of people. And so you co-design around the data and knowledge of what's working and why. You begin to develop more effective solutions, and that helps you maximize that positive impact. And so this notion of impact-led organizations rather than funding-led organizations, we are seeing more and more dialogue about this at the moment. And just quickly, the characteristics of an impact-led organization, these are sort of early thoughts that we've got around this, are looking at what the culture of the organization is in terms around its vision, purpose, strategy, leadership, governance, decision making, the foundations being in place that I've talked about, having the right people to drive that impact-led approach, and then having the right processes where you're making use of the data that you're collecting to actually drive continuous improvement. So when we're working with organizations, we go in and look at, do you have these characteristics in place? And if not, what elements do you need to build? And so we've been doing this work with CHL, I think for the past 4 years now, and really begin to see the embedding of a whole set of impact-led characteristics by them. Thank you. I'm happy to take questions now.
Yeah, thanks, Kevin. Look, Kevin, there is a question that we might pose to you actually, and maybe we can also have the other panel members comment on. It's in relation to measuring impact or real change in people's lives requires a long-term study. What is the appetite for longitudinal studies in Australia and New Zealand, Kevin, in your opinion?
I think the appetite varies, and I suppose that I would take the premise of the question of, do you need long-term study? Well, I think in certain circumstances they are great things to do. They're the gold standard, particularly when you're doing things like social impact bonds. Then I think they're a necessary component of that. But if you are a for-purpose organization beginning to grapple with the change you're making in a community you're working with, you don't need to wait to do a longitudinal study to understand that. And you can start by engaging stakeholders, talking to them about what change is actually happening for them and how you can better improve what you're doing. And thinking back to when we worked with CHL, the first part of work we did with them 3-4 years ago was really an engagement with 80 of their tenants to actually ask them what changed and what was the most important change that came about for tenants in CHL tenancies in different parts of the country. And that really shaped the CHL theory of change when they actually heard from tenants what the most important thing was. So while longitudinal studies are the gold standard, you don't need to start with the gold standard. I think you can begin to engage with stakeholders, ask some basic questions, then utilize that information to gradually improve your services.
Yeah, brilliant. Thank you, Kevin. Paul, any other comments around that question?
Yeah, I mean, certainly there's an appetite. It really does come down to resources, doesn't it? So, and do you have the connections, if you like? So it's very, very resource intensive to do a proper longitudinal study, to do pre and post. So virtually all of the data that agencies hold is just after pre. In other words, when someone comes into the service, and there's not actually pre-data. It's usually just a bit after pre, and it usually ends just a little bit before post. So, you know, just as on exit. So there's a great desire for agencies to go back in time a bit to understand people's lives prior to starting, and then to go forward and say, okay, support has ended, if you like. Someone's got into a good community housing home. How are we going to then measure over time? So usually agencies don't have the resources to fully, continue that measurement. And they certainly don't have resources yet to do linked administrative data. Now, we should be getting closer and closer to this, because technically there isn't really a problem there in terms of accessing linked administrative data. It comes down to the processes of ethics, etc., and so on. But over time, we would expect that an agency would be able to go key into government and say, okay, I want for my clients the kind of outcomes, and I don't want this at the identified level. I want it at the de-identified level. What was the pathway coming into my program, and what was the pathway coming out? I just want to understand my impact. So over time, we hope that happens, but right now it's really beyond most agencies.
Yeah.
So it's a question of resources, really.
Absolutely. And look, just another one for you, Paul, just while we're here. Another question came through a little bit earlier. Is there a ratio or dollars invested versus dollars saved calculation from the SHM?
Yeah, so if you look at the final report, you've got a return on investment. And so you can actually, and you can have a differential return, so relative to the control, what is the return? So it's all, you'll see a outline of those numbers in the final report. And I sent through a link to the Sacred Heart Mission website where you can actually download the report that gives you the dollar return.
Yeah, excellent.
That was only the health the health costs. Justice costs came from looking at the self-report because we didn't have the linked data on that. But of course, there are other savings that occur as well. But they were the two that we focused in on. And you can do further analysis of this. Again, it's a lot of resource time that you do if you're doing a proper cost-benefit analysis or a good SROI kind of analysis. It does take up resources.
Yeah, and look, just on the resources front as well, and maybe one for you, Kevin, is a question, and then we'll jump to you, Brett. But Kevin, there's a question here: how do small-scale initiatives get started with impact measurement when they may not have the people, processes, and foundations in place? Really good question.
Yeah, I think, you know, if you're a small organisation, 1, 2, 3, 5, 10 staff, then the starting point for me is that think about your purpose, really get clear on that, and then think about your theory of change. And that is, what's the situation that you're in? Who are the key stakeholders? What do you intend to do about those stakeholders in terms of what change do you intend to create? What are the outcomes that you want to create and see for those stakeholders? And then what funding do you need to actually bring about those outcomes? And I think if you move through that process of beginning to think about who the stakeholders are, what outcomes will happen for them, and reflect on that, then you put in place one of the solid foundations to begin to measure. And then it's looking at what data you're already collecting, what processes you've got in place to collect data, and whether you can add some outcome questions into those data collection processes rather than coming up with a brand new survey. So you're not having to put a lot of additional resource into it. And we're doing this with a welfare organisation up in New South Wales at the moment, where they do a big satisfaction survey each year. And so we're adding a few outcome questions into that rather than coming up with a brand new survey, because they've got one person who it's going to be tagged onto the job of.
Yeah.
So they're just building it into what they do rather than having to bring in initial resources. And then it's sitting down and building in a bit of time to reflect on the answers.
Yeah.
You don't want to collect data without thinking about it and what does this mean for us and what should we be doing differently. And so if you can put in that thought process and those little processes, then you'll begin to see changes in your organisation. It doesn't matter whether you're big or small.
Yeah, brilliant. Great response and great question. And please keep the questions coming, and there's a few more there to get to. But Brett, I'm conscious that this is a really important day for CHL with the release of your framework. I think we might jump across to you to hear a little bit more about it.
Yeah, great. Thanks, Mark, and thanks, Paul and Kevin. That's great. I might start by just acknowledging the traditional owners of country across Australia and pay my respects to the elders past and present. And I'm coming to you today from Woiwurrung country up here in the Macedon Ranges. So it's great. I'm really delighted to be launching our social impact framework today, finally, after 3 years worth of development. And just acknowledge that, you know, Lucy was really looking forward to being here, but I hope I can step into her shoes with as much aplomb as I can muster. When we started work on this back in 2018, we wanted to understand the changes that happen for our customers and communities as a result of what we do. And that 3-year journey has involved, as Kevin mentioned before, consultation with our customers and our tenants, our stakeholders, the communities we work with. And a part of what I should acknowledge today is really the fantastically generous time and that our tenants and customers gave to us during that process and the stories that they shared. As we've heard from Kevin and Paul, the idea of understanding and measuring impact goes well beyond describing our activities. So, you know, we house low-income people, or counting some of the most obvious outputs, like we house over 11,000 people, or we have a vacancy rate of X or an average rent of Y. So it gets us beyond that to what we think about the why, and why do we house people? What happens next for them? So perhaps to sort of come back and reflect a little bit on that issue of longitudinal study, what we've designed and put in place is designed to keep going. We're not expecting that this is a start and a stop in terms of the measurement, and we hope to be able to understand the change that happens to people over years, not just months or days or you know, when they get into the housing in the first place. So once we've articulated this clearly, then we started to measure it, and we can use it to make great decisions about what we do, about how we go about it. For example, where we're looking at where and how we can grow to meet more housing need. And we can also use it to report back about how we're going, what kind of impact we're making. Report back to ourselves, report back to customers and communities and the public, report to stakeholders and partners such as government and finance partners, all of whom are increasingly interested in impact and are really starting to value the wider impact of working with a community housing provider versus, say, a real estate agent. So I'm going to try and share my screen with you now and give you a bit of an understanding of what that framework involves. So bear with me for 2 minutes while I do that. So what you're looking at is a diagram of our social impact framework. And this, I guess, goes back to Kevin's explanation around the theory of change. It's how we sort of understand what's going on. And we fondly refer to it at CHL as the footy. And to introduce you to our framework, I'll take you through the elements of the footy. So at the top, you'll see CHL's vision, a world without housing poverty. It's both very big and very narrow. It's big because it's about the whole world, but it's narrow because we focus on housing. We don't help people generically, we house people. We're not a community service agency, we're a community housing provider. So we don't lose our focus on housing, but we do want to remember why housing matters. We house people because we house people so that they can do whatever is meaningful for them. And the heart of the framework is the statement that we support people to access housing that is safe, affordable, suitable and quality, and that gives people stability to build their life and their community. And that's the core insight from the framework, that stable, safe, affordable housing provides opportunities for people to improve outcomes in their other areas of their lives and to participate in communities in whatever ways is meaningful for them. And built around that fundamental element of stable, safe, affordable housing, the framework has 6 domains. We call them domains, where we can see impact. They're not ranked in order of importance. They're all potentially important to our customers and communities. And they are health, that's physical and mental health, education, economic participation, and that's not just about employment, but it's also about people's ability to manage their finances and budgets, empowerment, livability, and social connection. I said earlier that we use the framework to guide our decisions, and as an illustration, and I'll just actually stop sharing that. As an illustration, one of the domains we've pulled out recently is economic participation. And that doesn't equal jobs necessarily, because that's not everyone's goal in life. A quick side note, We've had a community development framework for a long time now. It's a robust, mature part of our work. It started with our work in remote Aboriginal communities in Western Australia, and we've extended it right across the whole organisation. And we're increasingly seeing this as a central part of our whole work, not just a sideline project to our core housing business, but absolutely part of our core housing approach, and as much as is important a service as maintenance. So to extend this approach and to put our social impact framework to work, we're developing a strategy to identify where we, as a social landlord, can make a difference in hiring tenants, customers and members of our communities, including seeing CHL as a channel into other employment opportunities. So we can give you a start. Partnering to increase access to other employment supports and services, supporting volunteering and skill sharing, supporting social enterprise, and using our supply chains and our partnerships to lever other opportunities for tenants and communities to bring in resources or pay less for things, and so on. So we're working on that now to build out that economic participation element of this social impact. But there's more. The social impact framework is also really a practical tool for measuring and improving the impact we have on our customers' lives. For each of those domains, there's a small number of key questions which we've developed, which get to the heart of the changes experienced by customers in those key areas of their lives as a result of the work we do. We can ask these in a survey or a focus group or any other format which works, and we don't have to ask them all at once. Like any other tenant satisfaction survey, we can pick one domain, for example, and really focus on that. In fact, what we're doing right now is rolling out the survey nationally to all of our customers via text and email links, inviting people to click and respond to the questions. And this will give us invaluable info about our impact nationally for the first time, as well as allowing us to test the methodology. I'm happy to report that since Monday, we've had 1,200 responses, and they came in the first 48 hours, which is an amazing rate, and tells us something about what that means to our customers and their interest in this area. This is what we hoped, that for our customers, participating in the survey means they can reflect on their lives and help CHL provide better services to them and to others. And for CHL staff, it really helps us get a gauge on how our customers are doing and what it is which makes the biggest difference. It helps us all reconnect with why we're here and whether we're having a good day or a tough day, and especially on the tough days, it's really valuable to be able to say to yourself, I remember why I'm doing this. So what I thought would be interesting now, and this is the audience participation bit, is to give you a little bit of a taste of the social impact survey questions, and following on from the questions that we asked at the beginning, there's two more which we kind of picked at random from the impact domains, and we'll run a poll on those two questions, and the results obviously don't matter today. It's just for you to see how we've framed the questions to give us the best chance of understanding what's changing for our customers and what part of that can be attributed to CHL. So if you're a social housing tenant, you could answer the questions from your own housing experience. If you work in social housing, perhaps you can channel your inner tenant. And for those of you from academia or other parts of the social service system, you can get creative. So let's run the first poll question. After we've done the poll, I'll talk a little bit about how we actually report on this and what the next steps are. So the first question, which is from the health domain, obviously, is since living here, I can better look after my health. Not at all, moderately, somewhat, very much.
We're getting a flurry of responses.
Fantastic.
Brett, so let's give that 15 seconds.
Yeah, good on you.
It's 64.5% of the audience have voted. It's like election night.
Yeah.
Too close to call at this stage, but let me let's end. I'll end the polling there, Brett, and I'll just share the results with everyone so we can have a look at that.
All right, fantastic.
There we go. You should be able to see that now.
There you go. Interesting. All right. Fantastic. Now, the second poll question comes from the education domain, and since living here, my child is able to attend school more regularly.
Okay, there we go. Okay, I'll end that now, Brett.
Yeah, great.
And share the results.
There you go. As you said, Mark, you should get your kids to do that survey.
Yeah, I certainly need to.
Yeah. All right. Now, if you were a CHL tenant, and just let me finish off by showing you a little bit about how that ends up looking for us. So hang on a tick. You would then, the data would then look like this from our dashboard perspective. So you'll see a little mapper of Australia there. We've divided all of this up into local government areas. So you'll see a huge patch up there in the top left-hand corner. There's not that many houses up there, and Perth is probably a tiny blue dot right down the bottom of the West Coast, but there's a lot more housing there. There's a thin blue line that travels down the east coast of New South Wales, something Victorians have always known. And up the top, you'll see that there's a series of filters. So you can search on age, you can search on sex, you can search on household composition, income source, and those sorts of things. And all of that will change, and it will give you the results in terms of the overall percentage. And then if you want to drill down, you can click on one of those circles and it will unpack all of those questions for you. So some of these you'll see are from satisfaction kind of questions, to what extent do customers understand their rights, responsibilities, etc. How affordable do they think their housing is, and things like that. So that's it, really. I'd thank you very much for the opportunity to explore this, and yeah, back to you.
Yeah, I think Brett, well done too, and particularly last minute notice. I think you've done Lucy proud, I'm sure, of what you've just presented. There are a couple of questions coming through, Brett, that we might throw to you just in response. One of the questions is, let's go to the simple one. Can I ask what tool CHL are using to collect surveys?
Yeah, we're looking at a range of things. So there's basically a web page that people go, like a web survey that people go to fill out the questions. We're distributing that through SMS via a link and through email via a link. We're not going out to people with hard copy surveys at this point in time, but we have been able to load that app on iPads. So when staff go out and do inspections, they're able to give somebody the iPad and allow them to complete the survey themselves while they do the inspection. If we do community events, we collect that information, any kind of engagement, and we're particularly promoting it to new tenants as they move in. And we've done a fair bit of promotion generally and education to our tenants around the whole thing. There's been brochures and explanations about what it all means and how it might benefit them in the long run too.
Yeah, and on the question that's come through on frequency?
It's just ongoing.
Ongoing, yep.
So we're just going to continue to do this. I guess we're going to be learning as we go about how successful this collection methodology is going to be. But we just took the decision that we just needed to take a bite out of the cherry and give it a go, yeah. And see how successful it is. I mean, if the first 48 hours are any indication, I think it's going to go well, but we'll see over time. Yeah.
Yeah. Eleanor Booth, Brett's comment, she really loves the CHL footy analogy. Just a question. Eleanor missed how long the frame was. 3 years.
Yeah, it was
put
3 years,
together? Yeah.
and largely because we really wanted to build it from the ground up. And as Kevin mentioned, when Think Impact first started working with us, you know, we went out and we interviewed 80 or 90 tenants. I can't remember, Kevin, off the top of my head. We spoke to lots of stakeholders and partner organisations and community members, and really started to build it up from the bottom. And tried to understand what was important for our customers, what was important in their lives. That led us to the notion of stability as the enabling part of the whole equation, and the sort of domains that we chose to measure. And then there was a fair bit of work done on the questions. We trialled this 3 or 4 times, I think, in different locations around the country and with different cohorts, and those trials were very successful. So, and that's led us to today. Yeah.
Yeah, and probably the other bit to chip in with that was the trialling of it also helped shape the survey questions and the survey methods.
Absolutely.
Survey methods that didn't work with particular groups. So through doing the trials, we were able to go, look, let's use the questionnaire in this way, or let's change this question because we're not getting the right level of response, people aren't understanding it. So again, it goes back to the question somebody asked earlier about if you're a small organization, what you don't need, like CHL didn't need to go, let's bite off the whole pie. It was like, let's nibble away at a few bits of it, learn, and then build up to do it effectively.
Yeah. No. But we're hoping to see the change over, you know, it'll probably take a year or more to really be able to measure any sort of effective change in that space.
Yeah. Can I just maybe throw to you, Paul? Really good question from Jackie Farrell coming through here around incentivisation for survey participation. What's your views, comments around giving people incentives to participate?
We do. That's if we can afford it, and it's paid for, obviously. So those incentives come in 2 forms. One, it can be a prize. You know, put your hat in the ring. If you answer this survey, you will be, you know, potentially a winner to get a certain prize, or we actually pay people cash to do the survey, and that does do some incentivization. It also recognizes that they are spending their time doing it. So that really comes down to those kind of longer surveys that we've done. For example, in the Journey to Social Inclusion, everyone was paid to do the survey. Right. They were quite long surveys, and they were over the phone or face-to-face. Difficult to have done those surveys online. So depending on the level of vulnerability and background and so on of the person, it might be a very incredibly expensive process, or it can be a very simple kind of online survey if people do have the, you know, the mobile phone and the laptop, and it's a relatively short survey. They're not necessarily expecting to be incentivized, and they can complete it themselves, and the cost is so much lower.
We've often incentivized our tenant satisfaction surveys, but we're not incentivizing this one. Although we're leaving our options open. It takes about 20 minutes to do this one.
Yeah, and as you said, Brett, you've had a good initial start. So,
Matt mentioned just there that you know, speaking in psychological languages, intrinsic and extrinsic motivation, and we find that those who are the most vulnerable are often very motivated by some kind of intrinsic kind of reward, which is they're actually often will state, I want this knowledge to help people and to support services. And there is quite a significant level of intrinsic motivation that we see. And it relates primarily to those who are the most vulnerable. So they have typically stronger motivation to help others, and for the data to be used in a positive way than others, as it turns out. So yeah, I refer to extrinsic motivations in terms of dollars and prizes, etc. But there's a lot of internal motivation to help others. So it's something to think about.
Yeah, brilliant. Look, there's a good question, Kevin. I might just throw to you, if you don't mind. Mark Reeder from New South Wales says, how do you build a framework which enables you to determine that there is a direct causal link to your intervention as opposed to the change being as a result of some other external influence?
Yeah, it's a very interesting question. I was literally grappling with that earlier on today in terms of a quite separate project. We have a framework of thinking about what outcomes are you actually in control of from your service delivery, what outcomes are you contributing to, and what would you like to see change contextually, but actually there's a lot of other factors that are completely out with your control. And I was looking at a project this morning which is about loneliness and actually trying to assess a contribution of an organization to tackling loneliness. And you could go, okay, well, they've done all this work, they're in control of it. But if you think about the last year and the effect of COVID, actually the context was so massively against them, you can't, loneliness has probably grown despite what they've done. So it's working through what are the changes you're trying to see, the thought process behind that, the logic of what you're doing, and we categorize outcomes on that basis of, are you in control of them, are you contributing to them, or are there contextual factors that are operating against you, or in the other way, actually making it easier for your outcomes to come about. And it makes it quite technical at points, but yeah, that's one of the methods we use to actually help people in that space.
Can I just pick up on that too, that obviously when you use something like a randomized controlled trial, it is in the social arena, and it's probably less difficult even in terms of vaccines. So I would say it's easier to run a randomized controlled trial on Moderna and Pfizer and things like that than it is to run a randomized controlled trial in the social world. But obviously that does have an inbuilt control factor in it. Randomized controlled trial, or if you're a small organization can't afford that, you just think about getting some data together that reasonably shows what would have happened had you not done this kind of work. So you can do it at the very high end RCT, or you can do it by just getting some numbers together. Kevin mentioned loneliness, and there was a question earlier about intangibles. Now, some of those intangibles are actually amenable to measurement. Well-being, loneliness are amenable to some good measurement. Loneliness happens to be a big area to really focus in on for programs in the community housing space, because we found very early on with a Mission Australia study in Sydney, a Housing First study. MISHA is one of the first Housing First programs in Australia. Mission Australia, the MISHA program, qualitatively, we were picking up in certain areas higher loneliness on entry to housing. It's something to really focus in on if you're a housing provider, because you can take people from a fairly active kind of world to an area where they've got stability in their home, but they may become more lonely. And that's where measurement really comes to the fore. That, yeah, we now illustrate that this is a big issue for you as a housing provider. What can you do to reduce loneliness on entry to a more stable position?
Yeah, great, fantastic.
The key bit of what I was talking about earlier on, Paul, of this notion of if you begin to look at the data you're getting, understand the impact you're having, like, okay, how do we use this? And for a social housing provider, it doesn't mean they need to start running non-loneliness services, but it means, like, who do they begin to partner with to actually connect their tenants or customers more into the community? So it's that use of the evidence and use of the impact and use of the data that's the critical part to managing for better impact.
Yeah. Brett, I'm going to just throw to you if I can. And again, I don't think we're going to have a worry with enough questions. There's going to be a lot. I think we could probably spend the rest of the day talking to our audience, but let's go to Joe Flood's question. His question or comment, it's interesting that you've gone for stability rather than more conventional affordability. Would you like to comment on that?
Yeah, well, that really came from our customers. So when we went to talk to them about what was important to them, yes, of course, affordability is important, maintenance was important, location, all of those kinds of usual, housing related aspects were important, but the real thing that made a difference to their life was that they could have a stable life, that they didn't have to move. They didn't, that their landlord wasn't selling the house and forcing them to, pack up and move yet again. That aspect of it was the most important thing that people told us was what helped them take advantage of things out in the world, because they had the stability at home. So we developed the notion of stability, and that stability is informed by affordability and appropriate housing and secure housing, but it's in a sense a notion unto itself.
Yeah, brilliant. And Brett, just to follow on one that's come through as well, a bit of a longer one. First of all, congratulations to CHL for the work you're doing, and for Think Impact for the great piece of work, as the writer says. As the survey is ongoing, are you seeing, or will you be seeing this as a pulse check reviewed at key points? Do you have any thoughts on how people's responses may shift or be primed over time, etc.?
No, I guess we're going to find that out.
Yeah.
It's a little bit hard to predict. My sense of it is that it'll kick off well, and then it'll sort of reach its own level, and then as tenancies turn over, we'll see a certain pattern emerge, more than likely. But I suspect that a lot of those learnings for us are yet to come.
Yep. Excellent. Just another follow-up from you, Brett. Again, this could be your full-time job, I think, which is good. Do you think the approach of getting tenants to fill out a survey in person with a member of internal staff, i.e. in a housing inspection, can alter the validity of their responses? And there was another question there that came through as well about being able to respond anonymously and the like. So what are your thoughts on that?
Yeah, so look, it's an issue that needs to be considered, and people need to be aware of those kind of dynamics when they do go there. However, I suppose what I'd say is that people don't fill the questions out for them. We will hand them the iPad and say, here you go, you can go over there and fill out those questions, and I'll be doing the inspection, and I'll come back and we'll collect the information. None of it is identifiable. So the way we've been able to set it up with our management systems, and I have to take my hat off to Sonara, our business improvement manager, who manipulates an awful lot of data manually, because we don't have an API set up with our tenancy management system yet. Nonetheless, we can guarantee the confidentiality of it, but we can still link it to programs, to household types, locations, etc. So people know that it's completely anonymous.
Right. Fantastic. We might give you a bit of a rest, Brett. I think have a sip of water there. But Kevin, Paul, we might throw this one. This came through very early on at 1:06. So I'm conscious, 1:06 my time. So I'm conscious that Kelly's been waiting for a response to this. So I might ask both of you to respond, Paul and Kevin, if you will. With regard to return on investment, are any of you aware of studies that compare the social housing projects to other well-funded options for investment, e.g. infrastructure and roads? I think that's a very good question in a political year to be asking. Kevin, Paul, do you want to respond to that?
I do think that most of the kind of social programs that we look at, we don't have as complete information around all the social outcomes, and so therefore can't do full valuation of dollar return. But in theory, of course, the nature of doing an economic evaluation is that you can do a comparison. So in theory, you should be able to compare returns across different utilizations of resources. So that's the theory behind it, but it is actually really difficult to put values on everything. And so a lot of our work has been probably a bit more cost offset kind of economic evaluation than full economic evaluation, because of the real difficulty in a complete economic evaluation. I would make one point though, in terms of what you see in terms of economic evaluations in the public sphere, and that is that I'll just give you one illustration. I remember looking at an economic evaluation that was supposed to be comprehensive, and the topic area covered social, environmental, and financial returns. And I was shocked because I was asked to look at it. I was shocked to see really what the consultant had done in this case was to say, I can't value the social, I can't value the environmental. So here's my financial return on investment. And I'm thinking, wow, you know, what's the point of this piece of work if you weren't valuing the social and environmental when they were so important? So comparing across has to be treated with a lot of caution.
Yeah, thank you, Paul. Kevin?
Yeah, I think it's an interesting, you know, space in terms of particularly social return on investment analysis. I mean, my understanding is there's probably only a couple of hundred of them that have been done in Australia in total. And one of the bits of work we did for a foundation recently was look at the ones we could get hold of, the ones that were publicly available, and begin to go, are there thresholds? And so we managed to look at all the ones that have been done in the housing space, all the ones in employment, in family violence, and look at what the thresholds of those social return on investment studies were and what the sort of range of dollar return was. And I think that's the start of a bit of a debate around, well, if you're investing in this space or this space, is there a difference? But to my mind, it's like, well, if you're a politician and you go, we've got the potential of $35 return from investing in aged care and $10 return investing in youth unemployment, they're actually so different that, you know, it wouldn't be the sole factor you'd make a decision on. So it's part of the equation, but it's not the only part of it. And I think the other bit that for me is still quite staggering around this is we did a separate piece of work for the Cross Yarra Partnership. So it's the people that are building the tunnels under Melbourne, and did a social return on investment on that. And the ability to actually get hold of publicly funded cost benefit studies that had been done on that type of work was virtually impossible. They sit behind closed doors in government. They've been done on a commercial and confidence basis, and the information isn't publicly available. So you're not doing a like for like analysis within that. And so I remember being involved in a big discussion with a few people from CSI around how we actually push the agenda to make sure that publicly funded pieces of work are made publicly available and that they don't sit behind freedom of information things, because there's a lot of economic analysis that have been done that you can't get hold of. So you're never going to be able to actually do the calculation and the like for like.
Yeah, and Kevin, just on that point, another question's come through that kind of relates, and the question is the plan to then equate dollar savings for health and justice by the provision of housing, i.e. similar to the social value bank?
I mean, I don't know if there's anyone on from the social value bank. I like it. I think the social value bank for me does a more predictive upfront assessment of what the value might be than what you would get through cost benefit analysis, a social return on investment work, an economic analysis that somebody like Paul might do, which is going to be a lot more rigorous and a lot more in depth. So again, I don't think you're comparing like for like. Again, we do bits of work with organisations that look at how can you assess potential social value up front and almost run little calculators, but we see them as quite different from a fully assured social return on investment study that's been through the international body for accreditation. So, you know, that could cost you 50, 60, 100, 150, $200,000, depending on the nature of the project. You can do a sort of value calculation as a predictive thing for a lot less. And it's the same as doing you know, what's our business plan, sketching out how you might make money vis-a-vis a full study of how your business has done over the past 5 years. They're not exactly the same. Yeah,
no, fantastic. Paul, can I just ask you a really practical question that comes through? I think it would help some of our audiences. Can you provide some examples of language used to ask or start questions, i.e. emotive questions versus practical physical questions?
Yeah, we do provide a bit of an intro to our survey. So even if it's online and we use Qualtrics for those surveys, we provide information about the study, why it's important, what it's going to be used for, and that kind of stuff gets people interested, makes them aware, gives them control, empowers them, because they then have to provide consent. You know, I consent to this. So it's not like we start with some very, very nice questions, but we do start with participant information and complete consent. And I find that when you provide information for why you're doing this work, what it's going to be used for, how you're going to analyze the data, why it's important to you as a person, the fact that you will provide them with the results of this work, that they find themselves being empowered. And certainly when they say, yes, I consent to this, but I don't consent to that, prior to them starting the survey, I think that gets you off to a good kind of starting point. So it's not so much that we try and throw in some really nice questions at the beginning. I don't think we really do that. I think we focus more on getting the person really ready and empowered, particularly through consent, to start the survey.
Yeah, brilliant. And just to follow up for you, Paul, then I'm going to come to you, Brett, just with a question. And thanks to those people who are sending these through. They're coming through thick and fast, which is great. Paul, the question goes back to what we were talking about before about providing incentives. The comment was, seem to remember reading that there is evidence that the introduction of extrinsic motivators, such as payments or prizes, actually erode intrinsic motivation. Thoughts on that? True, false?
Yeah, I answered that in the Q&A. Essentially, I can't, off the top, show you the evidence. I'm sure that there is interesting evidence to look at. I would be interested to know whether that evidence related to the kind of vulnerable populations that we primarily focusing on, because our finding is that both of these motivations seem to stay through the course. In other words, that just because you might be paying someone to do a survey doesn't mean that they stop being intrinsically motivated in our work. Now, that's a little bit anecdotal, I might say. And so I'd like to look at the evidence where that was the topic of interest. But we certainly don't find that kind of substitution going on. We find the two work together. We often find, by the way, that those who might not be getting the support can be very connected to the actual survey process. So there is a little bit of a I don't know, interviewer impact. And provided that the interviewer is really well trained and has a good, neutral but positive way about them, they have to be neutral, that the process of interviewing is often better than most people think. So we often find that people saying, oh, look, you can't have this long survey, or this survey will create negative impacts, et cetera, et cetera. In the vast proportion of cases, that's not true. In fact, the reverse is true. But you do have to have risk mitigation strategies in place, and you have to have people on call in case there is something that happens during that interview. So you do need to watch out for the risk factor if the survey goes into kind of personal areas. But in the main, our surveys have had positive rather than negative impacts on people.
Yeah, and Brett, just back to you, and I'm again conscious we've got a lot of questions to get through, so we're just chopping and changing a little bit to see if we can get through as many as we can, so please bear with me.
Sure.
Brett, one of the earlier questions UNESCO asked, is there any reasons why your model cannot be applied across all housing providers in Australia and New Zealand?
Can't see any.
No?
No, look, it's pretty simple by design. It doesn't involve a lot of resources once you get the technology right. I mentioned the API issue before. I mean, once we resolve that with our new management system, I think it will be even more streamlined. You do have to, picking up on the point that Paul just made, you do need to invest in training your staff.
Yep.
And empowering them to be able to support customers to deliver it. But it's very much a self-serve kind of approach. You know, the surveys are fairly easy to understand. I noticed somebody asked a question about plain English. Absolutely, that things need to be in plain English and where appropriate, translated. And you know, there's a cultural component there for Aboriginal and Torres Strait Islander people too, that we need to explore further. You know, once you get that running, it's not a high resource issue, really.
Yeah, Brett, can I just ask one just off the cuff, and it relates to the comment you just made around creating a culture, training your staff and creating a culture. Can you talk to, and maybe Kevin particularly could comment as well, the role of boards in the implementing the cultural values around this practice? What do you see as their role in creating that culture within the organisation?
Oh,
and how do they use that information?
Yeah, well, I mean, it's critical. I mean, the culture comes from the top. You know, our board is really committed to this. I think the feedback I've had from board meetings is that they're quite excited by it. Mm-hmm. I think it will give them a good touchstone in relation to the kind of outcomes that people are experiencing. And as time goes on and the information becomes more mature, you know, we will see the difference. You know, we will be able to understand if, you know, single mums in Kempsey are having trouble managing their household budgets, or you know, those kinds of things as well. And that can really feed into planning if we use that information right. So I think from a board's perspective, that's their opportunity to take advantage of that. I'm sure Kevin's got lots to say on this issue. But,
we used to joke, you know, we've all heard the phrase, you know, culture eats strategy for breakfast. I think it impacts for lunch. You know, that if you don't have an impact-led culture in the organisation, then you can do all this technical work around how you measure your impact, but it doesn't go anywhere. And, you know, I remember once, wasn't in the housing sector, but working with an organisation a number of years ago, where I asked a question at the board level, how much time do you spend talking about impact? And the answer was 0%. They spent all their time talking about money, how to raise money, operations and risk. Yes, no time speaking about strategy and impact. I just said, unfortunately, you're a for-profit company with the wrong structure.
A couple of things I'd quickly add to that, Mark. The next steps for us are to look at some other data sources that'll inform or give us context to what our customers are telling us. So, you know, we might be looking at ABS, employment data, or housing market information, or even information on our own stock condition in certain areas. So as long as we can align this information up. Now that presents the board with some pretty powerful tools if they want to use it. And when I showed you the slides about the dashboard, that's all interactive. It's not, I mean, it's not a static image. You know, you can drill down into that information, and that's available to everyone in our organisation, or will be.
Yeah, I think that's the critical bit. It's like, what information is going to the board to allow those good conversations about impact, and then how are the board holding the executive of an organisation to account in terms of impact discussions, and then that will flow into the organisation in terms of the culture. But I think the other element of the culture, and one of the bits that we've seen that's really positive in CHL, is that also the way the framework implementation's been designed, it's around how do the different teams in different locations use this information to have the impact conversations about what's happening in their locality. And as Brett said, the part of the way the framework implementation has been designed is it allows a team in a particular area to go, this is what our data is telling us about what we are doing well or not well, and what do we do different about it. And so each of the teams have there's an implementation guide for them that sits behind this, so it flows right throughout the organisation.
Yeah, brilliant. And I think, Brett, you commented, but Paul, you might have a view as well, is on the statement around easy English. Obviously, the easier the platform and the engagement, the easier or the better the results potentially.
Yeah, although you do have to be very careful. So yeah, in principle, that's absolutely fundamental. Yep. The key is, have you done some very basic validity and reliability testing on the instrument that you're applying? Because what the trap that organizations can fall into is they know that there are these instruments that have being used internationally and really strong, etc., etc. But they can't really afford to use that instrument. It takes too much time in the survey, etc. So they then create their own thing. And they really just need to be careful at that point that they've gone through some very basic validity and reliability testing on that instrument. Because what seems to one person who might have written the questions as, oh, look, this is right, turns out that quite a few people can't understand what it means, and the sentences used have inconsistencies in them and all that kind of stuff. So just be careful when you do that kind of work, that you've done some good testing. Even basic, what they call face validity stuff, really should be done when you do that. Yeah, it's very important to do that, and we've seen some good examples and some bad examples of that.
Yeah, I agree with that.
Brett, can I just throw to you really quick? I think this is a really important one that we get to, and I do apologise in advance. We've 7 minutes to go. I'm not sure if we're going to be able to get through all these questions, but let's go with a few more. Brett, for you, how are different levels of tenant capacity and understanding covered? The comment here is we have a large number of tenants with intellectual disabilities, so tenant surveys can be challenging. Great question.
Yeah, it is a really good question, and I would be lying if I said I knew all the answers to that one. I think it's a little bit horses for courses, so it kind of depends on who those people are and how you're approaching them, how well your staff are trained, all of those kinds of things. I think there is a role for carers in helping people understand surveys. I think when they're in those kinds of relationships, and that's a trusted relationship, that can work. And then there's the whole issue of language that Paul alluded to before. And I've got to say, you have to be careful about validating the question. You also have to be very careful about the translation. Yeah, look, it's an interesting question, and I think it's an area that we will discover more about as we move through this. And we're kind of committed to understanding more and more how we can better communicate and how we can help people understand both the nature of the survey and the questions that are being asked.
Yeah, brilliant. All right, panel, we might. I'm going to throw a rapid fire last question to you. So 30 seconds or less responses we're looking. We'll go with each one. Paul, we'll start with you. And we have touched on this a little bit, but let's start with the last question. Where would you suggest housing organisations start if this is just a brand new concept and they've never been exposed to this before? What's step one look like?
Step one looks like go to the CSI website and do my outcomes measurement workshop. No, quite seriously, you do need to start simply. And we did this work with local government professionals in WA, and we said, look, if we were to write an evaluation framework toolkit kind of thing that could be used by community development officers and local government, what would it look like? And it's a completely different thing to looking at, say, the UK Treasury's, evaluation handbook. Start at the beginning and go forward. And there's plenty of places to go to, including that thing that we did for local government in WA, which is all publicly available. Nice places to go to. Start with some basic program logic stuff that you can get off a number of different sites. The Kellogg Foundation did some great work 10 years ago. Still useful, really useful. So yeah, there's places to go, no question about it.
Okay, excellent. Kevin, I think you might say at the very next board meeting might be your response, your brief response. What's your thoughts on that?
Yeah, I mean, I think for me, it's making the commitment to do it. You're starting out on a journey, and you're actually then that journey will take you in a way to be clearer about your purpose and whether you're achieving your purpose. As Paul said, there's lots of available information out there. If you want, you can give Think Impact a call. We're more than welcome to help you with it. But there's lots of publicly available information around where you can get the foundations in place around, as we said, thinking about your purpose, getting the theory of change in place, building a basic outcomes framework. You don't need to make it too complicated. And then starting to report on your impact in your annual report, so that you actually have a section of that report that says, beyond these are the numbers, this is what's happened to the people that actually we've provided a service to. And the more you disclose about what change is happening, then I think the more that will that will drive you to think about how you improve.
Yeah, brilliant. And Kevin and Paul, there's the obvious generous discounts for AHI members when they approach your firm. So just a nod of the head will do for now. Brett, just lastly from your good self, your thoughts on that?
Yeah, well, just to maybe to add or build on what Paul and Kevin had said, I think, you know, think about your vision and think about the ways in which you work and how those ways can have impact, and talk to your customers. I think start with your customers and try and understand what their journey is and what their story is all about.
Yeah, brilliant. All right, well, look, the impact of my job in this discussion today is to let people go on time and not run over time. So hopefully that impact's going to be a good one. I just want to say thank you to the panelists, absolutely, for your time today. I think there is a number of questions we haven't been able to get to, which I apologise for our audience, but thank you so much for your time and your insight and what you've shared today. I think we're all going to get a lot out of this conversation. I think there's going to be a lot of firms probably knocking on your door, all three of your doors, on getting more assistance and some help. So well done. I want to thank everyone who's been able to get to the webinar today. Again, we appreciate your interest, and it has been strong. And just a reminder that we will get a copy of this video out to you so you can review at your leisure. We'll get that out very shortly. Lastly, and quickly, can I just say there's just one last thank you I'd just like to make, and that's to the AHI WA branch committee, of which we've got a number of people on the call today, Paula, Sean, Sonara, Catherine, etc. I just want to thank the branch in WA for instigating this conversation, because again, I think what we've seen is a wonderful hour and a half of time shared together. So again, panelists, thank you, and thank you to all the audience for your attendance today. Best wishes. Have a good rest of your week.
Thank you.
No worries. Thanks, Mark.
Thank you.